Today we're going to take a deeper look into Feline Idiopathic Cystitis, or FIC. As someone who's worked in the small animal ER and also had a recent personal experience with FIC, I've developed a better understanding of the condition. A couple Sundays ago, my cat Tucker presented with a urinary obstruction, and he was diagnosed with FIC. So I have both a work side of veterinary medicine perspective and also an owner's perspective on the disease, which has led me to an overall better understanding from both sides. Tucker is doing better, and he, as you can tell in the second photo, really liked his butorphanol. I also added this video in of some behaviors he was showing, which is straining and vocalization that are common to be seen with FIC for later purposes of this presentation. So, what is FIC? FIC is a subsector of the feline lower urinary tract disease realm, and it's basically a catch-all for the inflammation of the bladder with an unknown origin of the disease. All in all, when a cat is showing urinary abnormality, disease, or dysfunction, and there's not a known cause such as trauma or a urinary tract infection, it's diagnosed as this idiopathic or unknown disorder called FIC. This can be an acute or chronic condition as well. When it comes to FIC, the risk factors are really important in understanding the pathophysiology, so I went ahead and added them here. Looking into the risk factors for FIC, gender is a main component of risk, as male cats are at a higher risk for developing FIC due to their narrow penile urethra. If we also look at a cat's dietary habits, this can be indicative of the risk for FIC. Does the cat eat dry or wet food? Is the cat an avid drinker? If the cat isn't consuming more water, then they are at less risk for FIC. Change in routine, seasonal changes, environment changes, and other pets are all stressors, and stress is a major component to FIC and its pathophysiology, which we'll see here in a little bit. Also, looking at the feline urinary tract anatomy helps with a better understanding of the treatments and pathophysiology of the disease. So, when it comes to the feline urinary tract, there are four main players. This includes the kidneys, the ureters, the bladder, and the urethra. Now, the kidneys are what filters blood and creates the urine. And then the ureters connect the kidneys to the bladder, where the bladder stores urine and works with the urethra to excrete urine out of the body. By excreting urine and filtrating it via the kidneys, you're helping to decrease toxins in the body and create a better homeostatic environment. This is a way that the feline deals with waste management. And I've also included down below the differences in the female and male urinary anatomy so that you understand the narrow function of the male, which causes them to be at a higher risk. So let's look then at pathophysiology of the disease. When looking at the veterinary and research literature on the disease, I came to the conclusion, due to the most current research, that there are three main avenues in which we can look at pathophysiology of FIC. So starting with local external abnormalities, this is going to be related to things such as infections and viruses. So we're going to look at here, this is going to be an explanation of bacterial infection or urinary crystals and matrix plugs that have associations with FIC. My veterinarian explained my cat's condition as having a matrix plug due to increased urinary crystals, but it also can be seen with different viruses such as feline calcivirus or FCV or bovine herpes virus type 4, BHV4, which can be seen with increased antibodies in FIC cats, but this needs more research overall. Next, we're going to look at intrinsic and internal abnormalities. These are going to kind of work hand in hand and have some similarities, but intrinsic abnormalities are going to be related specifically to the bladder wall composition. Bladder wall is composed of urothelium, submucosa, and muscularis. The superficial urothelial cells are responsible for maintaining the bladder barrier and the permeability of the bladder, and they function depending on high resistance tight junctions between urothelial cells. They also depend on a layer of glycosaminoglycans, which are also called GAGs, and those are located on the luminal surface of urothelial cells. And they're also dependent on the unique lipid and protein composition of the urothelial cell membranes, which allow for that permeability. FIC cats generally show a decreased urinary concentration of total GAGs, which will be more important here in a second. Now looking at internal abnormalities, this is going to be related to stress, as FIC cats are more sensitive to environmental, psychological, and pathological stressors. These chronic stress responses are what's going to lead to this pain, immune activation, pro-inflammatory releases, and dysfunction of homeostatic regulatory systems. Basically, we're going to see the urinary tract and the neurological tract come together to cause the root of this disease. Overall, when we have stress stimuli, we're going to also have bladder abnormalities. So when we look closer at these diagrams, I want to make something clear to start out with. In cats, the Barrington's nucleus, which is a center in which the function of like bladder contraction and overall bladder characteristics are established, as well as action. That Barrington's nucleus is anatomically located pretty near to the fear pathway. So this means that the bladder is at risk during stress responses. Now, when we have chronic stress in cats, we're going to see a decrease in cortisol, as cortisol is more related to like a fight or flight immediate response or an acute stress response. But we're looking more at chronic stress, which is going to be related to ACTH, which is released by the anterior pituitary. And because of this decrease in cortisol, we're going to have some decreased function in the adrenal cortex, which is going to impact the sympathetic nervous system. Now, with this chronic stress, we're going to have a activation of the sympathetic nervous system that is at a heightened manner, obviously, because we're stressed. And so when this happens, when we have this increased activity, this can cause stimulation of C fibers, which are unmyelinated pain sensors in the bladder submucosa, and they release a molecule called substance P, which is a neurotransmitter. In cats with FIC, we see an increase in these substance P receptors, meaning that they're more increased in pain, because this is a pain sensor. So it's kind of related to these C fibers, which you can see in this diagram. That's going to directly impact the uroepithelium in terms of bladder contraction and permeability, and pain and release of their molecules as well. When we see raised expression of norepinephrine, we're going to have an impact on this adrenal cortex, and they're going to release an increased amount, causing an increased release of nitric oxide from the urothelium and afferent nerves of the bladder strips, which is going to cause issues in the bladder. Looking even closer at this diagram, we can see again cortisol and ACTH's role, and they're basically going to increase the activity of the bladder, which is going to cause bladder wall degradation and impact overall bladder function because you're overstimulating the bladder. All right, so we're going to look at how to formulate a diagnosis for FIC, and we're going to take into consideration behavior, a physical exam, lab work, and imaging. All right, so when it comes to FIC, urinary obstruction is going to be the main presenter of FIC. So that means that we need to be proactive in understanding the symptoms of a urinary obstruction. This can be straining in the litter box. You're going to see behavioral aggressions, just hissing and growling as the cat is in pain. They're also going to be having an increase in the amount of grooming that they do, especially to their genital region. They might also vocalize during urination and have decreased appetite and water intake as well. So after you witness this relentless behavior, possibly even see blood in the urine, you're going to take your cat to the vet and they're going to do a physical exam. Now, when I talk about blood in the urine, I want to talk about when they're doing the physical exam. They're going to first take vitals because those are really important in evaluating the progression of the disease, but also they're going to try to express the bladder. So they're going to feel for the bladder and see how big it is. And usually cats with urinary obstruction are going to have a large bladder and it won't be able to be expressed. So my cat released only 1 drop of bloody urine when they tried to express his bladder, which is indicative of an obstruction. Next, we're going to go into lab work. So lab work is going to be done specifically in blood work. We're going to look at 3 different molecules or substances. So you're going to see in a cat with FIC increased creatinine, increased potassium, and also calcium, as well as an increase in BUN, which is blood urea nitrogen. And this is because the bladder is not functioning correctly and these molecules are not being properly filtered out. So you're going to see them in the blood work. When we look at a urinalysis or a urine sample, we're going to be looking for crystals, blood, white blood cells, and protein, just to rule out that we don't have any underlying cause for the disease. As I mentioned before, this is an idiopathic or unknown disease, so we want to rule out any other causes for the issue at hand. All right, now we're going to move into imaging. So if you look at this ultrasound image to the left, you can see that the bladder is enlarged and has some crystallization going on, which is indicative of FIC. When doing a fast scan and seeing a large bladder that can't be expressed, that's when you're going to decide that urinary blockage is occurring. You're also going to see on x-ray, you can also see an enlarged bladder, which is also indicative that the cat is blocked. All right, what are the available treatments? Today we're going to look at drug therapy, behavioral therapy, and dietary therapy. So for drug therapy, first we're going to look at smooth muscle antispasmodics. So these are drugs such as acepromazine. And when a cat has urinary disease, they might have abnormal bladder contractions or urethral contraction, or even like penile contraction. So that's going to be of a discomfort to your cat and can cause pain. So these drugs are going to inhibit the receptors and release of Ca2 plus from sarcoplasmic reticulum to decrease muscle contraction. Opioids are also really helpful in allowing for pain management. This condition is not particularly a great time for your cat, and they are in a lot of pain, and that can lead to stress. So that kind of creates a cycle of like stress and then causing an issue. So these opioids are going to help with that, and also can help with pain management from procedures such as AU calf placement. My cat, for example, is on butorphanol. Antidepressants such as alprazolam can increase serotonin and help with overall stress for a chronic FIC cat. Like I mentioned before, GEGs are a part of the barrier for the bladder, and when they are impaired, these supplements can help replace and repair that bladder wall. All right, so when we look at behavioral therapy, the main term we're going to use here for that is going to be multimodal environmental modification. And this is an addition of one or more factors to a relatively impoverished environment to improve the physical and psychological welfare of cats. This is going to help with that overall maintenance of stress, like we talked about in the pathophysiology. This might be adding a safe hiding place for your cat, allowing them to be mentally stimulated by natural predatory behaviors through play and different toys. Additionally, proper resources. What I mean by that is that if you have a multi-cat household, that can be a increased risk for FIC, as it is an increase in stress. So making sure you have a proper amount of litter boxes, which is an additional one for the number of cats that you have. So if I have 2 cats, I would have 3 litter boxes. That just helps lower your cat stress and lower competition between cats. Feel Away is also a helpful substance. It is actually a synthetic analog for feline facial hormone and can help prevent stress in cats. All right, so when your cat is diagnosed with FIC, unfortunately, the bearer of bad news, aka your veterinarian or vet tech, is going to tell you that your cat's going to have to be on a urinary diet for the rest of its life. So for this presentation, I just included the Hills versions of these diets, but brands such as Purina also have urinary diets as well. So you can elect for a dry food or a wet food urinary diet. Wet food is more commonly recommended as it increases water consumption in your cat, which can help with better urinary health. But dry food can also be soaked, which is what I do for my cat. The Hills diet also has a multi-stress CD, which can help with that stress component, as well as a dietary component to your urinary health. It also helps with that management of stress. My vet said that Cosequin, which is a joint supplement, can also be helpful in preventing blockages in cats. Also, I did some look into cranberry extract for cats with FIC. However, FIC is not related necessarily to UTIs, so the research is still being done on this and wasn't super indicative of being beneficial, but it is a possibility that can help with preventing blockages and increasing urinary health. So like I've hinted to before, when your cat is diagnosed with FIC, it's usually because they have become blocked and they have a urinary obstruction. So what does that look like for treating a urinary obstruction or blockage in hospital? So the first thing that your veterinarian is going to do is they're going to confirm that diagnosis. That's through imaging, palpation, physical exam, and blood work. And then based on that blood work and the vital signs that are collected by the veterinary professional, you might need stabilization, and that's going to be IV fluids and other drugs to help create homeostasis and just balance out those blood values of like potassium, calcium, BUN, creatinine, things like that. Because to place a urinary cath or a UCath, which is the next step, it needs to be done under anesthesia, and by stabilizing the patient, you're going to decrease consequences of using anesthesia. So they're going to place this urinary catheter, drain the bladder, and then once the bladder is drained, they're usually going to be on IV fluids to help monitor their urinary output and to promote them to start urinating themselves rather than excreting through the UCath. Usually the UCath stays in hospital for 24 to 72 hours in hospitalization, but you can choose to have your cat blocked and go home or stay for hospitalization, but hospitalization with IV fluids is the most recommended for preventing reblockage and better FIC prognosis overall. All right, so what are some emergency procedures, or I guess just procedures in general that are associated with FIC and urinary blockages? So the most common that you see is a UCath placement like we talked about before. I love this image because it just shows anatomically how narrow that urethra is in the male cat. And it also just shows you the placement of the UCath, which I think is really interesting when looking at anatomy. I think it's also important to look at and see just how narrow that is, to just understand that after your cat has a UCath placed, they're probably still going to be straining in the litter box, and their pain management is going to be really important because that procedure is not fun for them, and they're already have a urinary tract that's super upset, and then adding the UCath does not make them any happier. So I just like to add that in there, just as an owner's perspective. Also, a perineal urethrostomy, or a PU, can be done to widen that urethral opening and kind of help with chronic FIC patients to make them less likely to obstruct overall. The prognosis for FIC cats is actually pretty good. Mortality is about 26%, but more than 70% of the cats with FIC live longer and survive up to 10 years, which is great. There's also new research being done by Michigan State University with mesenchymal stem cells to repair the bladder wall, as well as different research when it comes to treatment. In the veterinary clinic, when I usually see mortality, it's due to cost of not being able to afford medicine, or cost not being able to afford unblocking. So that's where pet insurance comes into play. And I think overall we'll continue to see a better prognosis for these cats with an already positive prognosis currently as well. These are my citations, and thank you for listening to my presentation.